Hi, my name is Alicia Buchanan. I am doing a presentation for Intro to Communication at Mayland Community College, and it is on why preventive medicine is important. The first thing is I would really want you guys to understand why preventive medicine is important and how to maintain a healthy lifestyle at the end of this presentation. Did you know that the chronic diseases that are responsible for 7 out of 10 deaths among Americans and 75% of Americans' health spending are mostly preventable? I'm going to tell you in this presentation how to, the 3 ways you can participate in preventive medicine and how you can keep yourself in a healthy lifestyle. Number 1 is maintaining good health habits. It's the most important part of preventive healthcare, and I will elaborate on this in just a second. The second is when you have periodic screening exams. There's different ones for males and females. They can really be a help when you are diagnosing some disorders and diseases early on in life. And the third is to keep your immunizations update. With time, immunity from childhood can wear off in a sense, so you need to have your yearly flu shot and your tetanus shot every 10 years. That way, you can be immunized against those diseases. Okay, on maintaining good health habits, a couple ways you can maintain some good health habits is daily exercise, weight control, and proper nutrition are all tied in together. Daily exercise can help you from having elevated blood pressure, and some heart conditions can also be prevented by daily exercise that will be diagnosed later on in life. Exercise and weight control can also improve your mood and really boost your energy pretty significantly. Another way of having good health habits is abstaining from smoking and drug use. That's an ideal advantage for a perfect way of maintaining good health habits. If you're not going to exercise daily, or if you're going to exercise a couple times a week, then definitely not smoking and not using drugs can be in your advantage. And studies can show that 20 minutes after you stop smoking, that your blood pressure and heart rate can drop significantly. The second thing is periodic screening for adults. That's a big part of preventative medicine. For women, a yearly physical exam that includes a pap smear and a mammogram. It can be a vital part of early detection of some diseases and disorders. It's also very important that women know how to do a breast self-examination. It's a monthly exam that a physician or a medical assistant or a nurse can teach the patient to do monthly, the same time every month. And if there's any changes or there's any concerns, then you definitely need to go see your physician about those, especially if there's a big change from one month to the next, because that can really help in early diagnosis of breast cancer and other things that go on. For women also, their yearly exam should include lab work that includes a cholesterol check and a thyroid check. If your thyroid is not working properly, it can overfunction or it can underfunction. I know this sounds weird, but if it functions too much, then you need to take medicine for that. But also, if it functions not enough, you'll also have to be on forever thyroid replacement. And it's really when your thyroid is too high, they call it hypothyroidism, and that can cause a lot of issues with weight and other issues. And also, if the woman is over 50 years old, she needs to have a colonoscopy. And if she has any family history of breast cancer or colon cancer, then she definitely needs a mammogram or a colonoscopy about 10 years before the recommended age of no one with any family histories. And for men, they should also have a yearly physical exam that includes a prostate and testicular exam. And it also, they need lab work as well that checks their prostate-specific antigen, which, if elevated, should be evaluated by a urologist. But if it's elevated, then the chances of prostate cancer are increased, and if monitored closely every year, the physician and patient can keep an eye on it and catch cancer early on. Both genders, like I said earlier, for women, should have a yearly cholesterol check to help screen them for hyperlipidemia or hypercholesterolemia. That can lead to heart attack or stroke if it goes unattended for a certain amount of time. They should also have a yearly colonoscopy for the man and the woman, or male and female, after they turn 50. Okay, and keeping your immunizations up to date. All patients should get their yearly flu vaccine, and you should also keep your tetanus up to date. If you have a tetanus, you only have to have a tetanus shot every 10 years. That protects you against the disease tetanus. Like if you was to step on a rusty nail, you could get lockjaw, and you could potentially die from tetanus if you don't have your tetanus shot up to date. Patients who are around newborns are now being recommended to get a tetanus, diphtheria, and pertussis vaccination, which they call a Tdap. They get this because it has pertussis in it, which is also called whooping cough in newborns, and it can be really extremely fatal to a newborn if they get it. They could be hospitalized and it could be fatal. Elderly patients should also get, like, over 65, or if you've already had shingles, or if you've never had shingles when you turn 60, you should get the shingles shot, and you should get the pneumonia shot. Patients over 65 are really susceptible to getting pneumonia and shingles, and they are two diseases that can be very trying on an elderly patient. And the summary of the main points here is maintaining good health habits are important in preventive medicine because you can improve your lifestyle and help prevent yourself from having some future medical conditions. Periodic health screenings by your physician are important because they can detect precursors in some diseases and disorders. And the last is keeping your immunizations up to date. They can be helpful because they can keep yourself and others from getting sick, and they can actually keep you healthy overall. And the last thing is preventive medicine is good for anyone's overall health, and it can be very effective when trying to maintain a healthy lifestyle. Preventive medicine really is a crucial part of keeping yourself intact, and you need to get your annual checkup and just make sure that nothing's going on. And if you have any concerns, especially if you have any concerns, you really need to see a physician sooner than later. Thank you.